Namaste. Myself Dr. Sandhya Manorenj, working as an associate professor in the Department of Neurology, Princess Esra Hospital, Deccan College of Medical Science, Hyderabad, and also as a senior consultant neurologist in the Pace Hospital, High-Tech City. Today, that is 29th October 2020, is celebrated as a World Stroke Day. The theme of the World Stroke Day is Join the Movement. On this occasion, I would like to talk a few words about the stroke, so that the understanding of the knowledge to the general public is very important about stroke. 1 in 4 adults can have stroke in their lifetime. So, regular exercise can reduce your risk of stroke. Hence, join the movement. Regular exercise to reduce the risk of stroke. That is the theme of the World Stroke Day 2020. So, what do you understand by stroke? Stroke is a condition where there is sudden onset of neurological deficit, that is acute neurological deficit. A person can come with sudden loss of vision, one half of the field he cannot see, or there is weakness of the face or weakness of the upper limb and lower limb. This occurs either due to decreased blood supply to the brain. It can also occur to the decreased blood supply to the spinal cord or to the retina. So that is called as ischemic stroke. That is the majority of the stroke. Another type of stroke is hemorrhagic stroke, where there is rupture of the blood vessels due to the high BP. That is hemorrhagic stroke. Why it is important? Because prevention of stroke is important, as stroke accounts for majority of the cause of disability and death. It accounts for third common cause of disability and death in the entire world. One should know the knowledge of the risk factors of the stroke. The risk factors of the stroke are modifiable risk factor. That is, one can modify these risk factors. These risk factors are most common being the hypertension, that is high blood pressure. Secondly, diabetic mellitus, that is high blood sugar. Alcohol use, smoking use, coronary artery disease, any heart disease, so that clot forms from the heart and then go to the brain. Other risk factors are obesity or sedentary habits, not doing any exercise, and last is the dietary. Unhealthy diet is also a risk factor for stroke. So how a common man can clinically suspect stroke sitting at home? So there are 4 words, that is FAST. FAST, that is act fast. Stroke outcomes can be improved by acting fast. Face, F stands for face. Face means face drooping. Look for any uneven smile. Arms, arm weakness. Is one arm weak? Can you lift both arms? Speech, that is speech difficulty. Listen for slurred speech, any slurring of speech. Do people understand your speech? So these are the signs of stroke. Then T is the time. Time is brain. So go to the hospital immediately, preferably with an acute stroke unit, the place where acute stroke unit is available. You should rush the patient or a person with such features to the nearby hospital as early as possible. Why time is brain? Because every 1 second decreased blood supply to the brain, 32,000 brain cells die. So in 59 seconds, 1.9 million brain cells die because of ischemia. So each part of the brain has certain function. So we need to take the person as early as to the hospital, because if the person reach within 4.5 hours of the stroke, this can be reversible. So thrombolytic agents given in acute ischemic stroke are 2 types. One can be given through IV line, that is if you go to the hospital within 4.5 hours of stroke. The other method is through the catheter. What happened here? Mechanically clot is removed through the arteries. So in such cases, this type of thrombolytic agent can be given if the within 12 to 24 hours. So best is to reach as early as possible, so that there is complete recovery. So at the end, I want to suggest that prevention is better than cure, as we all know. Prevention means prevention. Control your blood pressure, control your sugar levels, good healthy habits, that is healthy diet and regular exercise, avoid sedentary habit, reduce your weight. These are the factors which will help you to prevent stroke. Next is, if with this all still you develop stroke, then you should rush the person to nearby hospital as early as possible because time is brain. If you act fast, these all neurological deficits can be reversible. Thank you. Thank you once again, and join the movement. Join the movement to reduce the risk of stroke for yourself.